Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Polycythemia Vera. What is Polycythemia Vera? This is a rare chronic disorder of the adult, usually around the age of 60, is defined by the bone marrow's excessive synthesis of red blood cells. This ailment is categorized under the more general term of myeloproliferative neoplasm, which are bone marrow illnesses characterized by overproduction of specific blood cell type. So, Polycythemia vera is a myeloproliferative tumor. Red blood cells are the most commonly affected by Polycythemia vera. Okay, so what happened to the red blood cell? There is overproduction, but it can also result in higher quantities of white blood cell and platelets. So Polycythemia vera, mostly there will be increased number of the RBCs, but there may be increased number of white blood cells and also increased number of platelets, but mostly it is the erythrocyte or RBCs. What are the key features of Polycythemia vera? Elevated red blood cell count, splenomegaly, enlargement of the spleen, increased blood viscosity, risk of blood clot. People with Polycythemia vera have a higher risk of developing blood clots, which can lead to serious conditions like stroke, heart attack, deep vein thrombosis. Itching and headache. Some patients with Polycythemia vera experience symptoms like itching because of release of histamine from the basophil and from mast cells, especially after a warm bath, and headache. High hematocrit level. Hematocrit is the ratio of RBC to the entire blood in the hematocrit tube. So its level is high, maybe above 55, maybe even 70% or 80% of the hematocrit tube is occupied by the RBCs. Erythromelalgia. Polycythemia vera is also linked to this syndrome, marked by uncomfortable warmth and redness of the extremities. As a whole, there is more blood volume, more blood cell production, so there will be a bit of plethora, body is swelled up, okay, and extremity feels red and warm due to excessive RBC and blood volume. Pathogenesis of Polycythemia vera. The main cause of Polycythemia vera is thought to be a genetic abnormality that interferes with the bone marrow's capacity to regulate blood cell production. The outline of Polycythemia vera pathophysiology is provided below, like what? Mutation of JAK2, the genus kinase 2 protein, which is encoded by the JAK2 gene, is essential for signaling cascades that control the generation of red blood cell. That means the production of the red blood cells. The JAK2V617F mutation in the stem cell is a particular mutation that affects the JAK2 gene in Polycythemia vera. The mutation results in unchecked cell division and proliferation in the bone marrow by persistently activating JAK2 protein. Okay. Increased signaling. Hematopoietic stem cell in bone marrow get constant signals from the mutant JAK2 protein, telling them to produce more blood cell, especially red blood cell, but also to some extent more production of the leukocyte and the platelet. That's why it is a polycythemia. Diagnosis of polycythemia vera. Diagnosis of polycythemia vera involves the combination of clinical evaluation, laboratory test, and imaging studies. Like what? Complete blood count, hematocrit that is high, hemoglobin that is high, erythropoietin level usually low or maybe normal. This is the difference between physiological polycythemia or secondary polycythemia due to cyanosis, due to low oxygen level. In that condition, the erythropoietin level is high, but in case of polycythemia vera, erythropoietin level is low, maybe normal. JAK2 mutation test. Most patients with polycythemia vera have a specific genetic mutation known as the JAK2V617F mutation. Bone marrow examination is very important to diagnose polycythemia, and sometimes you need imaging study to assess the bone marrow as well as the enlargement of the spleen, maybe enlargement in the late stage of the liver. Complication of the polycythemia vera. Polycythemia vera can lead to various complications due to overproduction of blood cell and increased blood viscosity. The following are the common complications associated with polycythemia vera, like thrombosis because excess RBC, splenomegaly because excess production of RBC plus excess turnover of RBC, excess breakdown of RBC in the spleen, hemorrhage. Paradoxically, despite the thicker blood in polycythemia vera, thicker means high specific gravity, high density, there may be a higher risk of bleeding, especially from gastrointestinal system or mucosal membrane, like it may happen from the stomach, from the nose, there is epistaxis or nosebleeds, gum bleeding, etc. Okay, it may be from the respiratory tract, it may be from GI tract. Changes in coagulation factor and platelet functions are the cause of this. Hypertension. Elevated levels of red blood cell may be a factor in hypertension, which raises the risk of cardiovascular issue like heart disease. Like that of, it may lead to ischemic heart condition, it may lead to congestive heart failure, because heart has to pump a lot of blood, and one time it begins to fail, or there may be some thrombosis in the coronary circulation that may lead to ischemic heart attack. Erythromelalgia. This is a condition characterized by painful redness and warmth in the extremities because of excessive blood flow and excessive RBC. Blood flow to the periphery is less and on the skin, but as a whole there is stagnation because of excessive RBC. Myelofibrosis, and in a few percentage of the polycythemia vera patient may develop leukemia. Gout, that may happen due to excessive breakdown of RBC. There will be high uric acid level. Itching, again there is release of histamine from the basophil. And peptic ulcer, again lack of blood flow because of excessive RBC. The blood clotting factor and the platelet may not reach close to the mucosa, so there may be peptic ulcer. Treatment of polycythemia vera. Common treatment approach for polycythemia vera include phlebotomy, that is taking out of blood from the vein, venesection. Medication, we have multiple medication, hydroxyurea, interferon alpha, or ruxolitinib. Hydroxyurea decrease the blood cell production. Interferon alpha also has some role to control the blood cell level, number of blood cell level. Ruxolitinib is working against the protein and the JAK2, so that there will be no genetic problem associated with high level of RBC. So it works on the JAK2. Okay, so that is the ruxolitinib, and it works when other medication fail. We have to know hydroxyurea also used in case of sickle cell anemia. Low dose aspirin may be required to decrease the chance of thrombosis. Okay, it may be helpful. Monitoring and follow-up and cardiovascular risk management. Splenomegaly, splenectomy. In unresponsive splenomegaly, we may use splenectomy. Okay. And prognosis of polycythemia vera. The prognosis can differ significantly depending on several variables such as patient's age, general health, the existence of particular risk factor, and the efficacy of treatment. Polycythemia vera is typically a chronic illness, and managing the condition and preventing complication has a significant impact on prognosis. It is imperative that patients collaborate closely with their healthcare provider, like a hematologist, to create a customized treatment plan and get ongoing monitoring. The survival time varies from 6 months to 12 years. So if a person goes through repeated phlebotomy under supervision of a hematologist, physician, they may survive up to 12 years. Otherwise, patient may die within 6 months to 1 year. Also, many factors: age, above the age of 60, more chance of getting death early. Okay. Other existing health problem may also increase the chance of mortality. And that's all about the polycythemia vera. I have taken this information from multiple resources. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.